Okay, so for the final video of this presentation, I was going to do a hands-on demonstration, a little more up close so you can see a little bit better. I am a visual learner, so I feel like a lot of times I'll read something, I might not absorb it, but if I'm told again, like I said before, using a model or some form of a picture with the dialogue, that will help. But then to actually be able to do it is when it really starts to sink in for me. So I like to present things that way if it allows, if the subject allows. So with my lovely Typodont here, I have an adult-sized mouth, which is fine. The fluoride is fine for children. It's also fine for babies. The very first tooth, when it comes in, they're allowed to do the varnish on. One of the positive things about the varnish is there's a lot less ingestion, simply because we're applying it directly to the tooth. There's no way for it to absorb into the mucous membranes or get swallowed. So even if a baby has one tooth, a lot of the women centers for the different state programs and obstetricians are available to give fluoride, a topical varnish fluoride, and that's great for them preventatively. So with this Typodont, this is adult size. Like I said, it's fine for an adult. Contraindications, there are some depending on what type of fluoride you're using. One of the big ones with the varnish is if you have a pine nut allergy, you're not supposed to do that's contraindicated. Also, if there's any sort of mouth sores or lesions. So the very first thing you're going to want to do with the patient is look in their mouth for mouth sores or lesions. I always attach a glove to my Typodont. It gives a little more of a realistic feel. Because there is a cheek there on a patient. They don't open typically as wide as we do with the Typodont. So for the very first step would be, like I said, look for lesions, make sure there's no contraindications with the patient. They can have fluoride up to 4 times a year. That's what's a typical recommendation and allowance of the fluoride varnish. The next step you're going to need to do is keep the teeth somewhat dry. That's the glory of the varnish, is they don't have to be as dry as the gels and foams did, the trays we used to use to apply those. So we're going to use a 2x2. You can use cotton rolls, good old cotton rolls. And of course the saliva ejectors come into play a little bit if there's a lot of excessive saliva. You're going to have them open. You're going to dry their arches and have them remain open in between. Again, this is a great time to hang the suction from their mouth or allow them to hold it to kind of remove any excess saliva. A trick I learned back in hygiene school that I loved when we used to use the trays was the dual saliva ejector placed in the 1 HVE, the high volume evacuation suction. It works really well. You get the high power of the high power suction within 2 saliva ejectors, making it a lot more user friendly. I love this for sealants. Love this for sealants. So we've dried the teeth. It doesn't matter if they're perfectly dry. That's fine if they're not. Then we're going to open our varnish. And what's awesome about the varnish now is it comes with the little brush. And you're gonna and the fluoride varnish is right in the packaging. So you're just gonna mix it up and kind of get it activated. And then you're gonna be doing a small thin coating over each tooth. So you've dried the teeth with the 2x2. It is okay, like I